Hey guys, welcome back to Medical Coding with Blue. Okay, so it's Quiz Friday, Saturday edition. I'm really sorry I've been doing that lately. It's just stuff that's been coming up randomly, and it came up randomly last night. And then on top of that, just letting you guys know, there's only going to be 7 questions for today's quiz. I don't know what happened to the other page that has all my questions on it, but we're only doing 7 questions on this quiz today. We will be discussing the answers on Answer Monday. If you have a 2017, 2018, or 2019 CPT book, you should be good to go. If you have a 2018 or 2019 ICD-10 book, you should be good to go. Now, one other thing I wanted to mention. If you hear something like about CPT-4, CPT-4 just means current procedural terminology 4th edition. That's all that means. It's not anything different. It's not different coding. It's not a different set of codes or anything like that. It is just the technical name of current procedural terminology. That's all that is. So if you see that, don't panic. That is just literally what it's technically called. And we as medical coders, we know what CPT is. If somebody is writing like a job description and they say CPT-4, it may be because they're not medical coders, but they think that this is what medical coders are supposed to have or supposed to be able to know how to do. Which, yes, we are supposed to know how to do current procedural terminology, but this 4 just means 4th edition. All right? So let's go ahead and get started. One other thing I wanted to mention before we get started is I did heavy on the diagnosis because remember we're in pulmonary right now. So I did heavy on the diagnosis only because in more diagnosis than anything, I don't have a lot of procedure coding on here this time, only because I wanted to make sure that you guys are grasping the very subtle things about pulmonary. Okay, there's a lot of very subtle things when it comes to coding pulmonary. So I want to make sure that you guys are concentrating on those little details. And if we have to take a step back from doing procedure coding, you know, I think it's better that way because I want you guys to be able to catch those little nuances. All right. So let's go ahead and get started, and we will be discussing the answers on Answer Monday. All right, here we go. Number 1. The patient with pulmonary hypertension presents for bronchodilation responsiveness with pre and post bronchodilator administration. Incidentally, while at the appointment, the patient discussed their left-sided heart disease with peripheral edema. A cardiology nurse was dispatched who escorted the patient to the clinic after his pulmonary testing, the cardiac clinic. All right. Number 2. The patient presents with a chief complaint of noisy breathing. Upon examination, the patient's breathing produced a high-pitched whistling sound. Okay. Number 3. A patient with asthma, cough variant, along with allergic bronchitis will be started on Advair and Albuterol with the follow-up appointment scheduled in 6 weeks. Okay. Number 4. The patient is a 22-year-old with a long-standing history of asthma. She has not needed a controller medication in 2 years. She is currently 15 weeks pregnant and has recently experienced increasing symptoms of shortness of breath. The decision was made to restart her use of Advair. Okay, number 5. The patient has pneumonia due to Streptococcus pyogenes bacteremia along with a pulmonary abscess. Okay. Number 6. The patient presents for a routine follow-up. Their chief complaint is interstitial pulmonary disease. Due to the season, they have been being seen for allergic rhinitis due to pollen. After reviewing of imaging, the patient is otherwise stable and can continue with antihistamines for rhinitis relief. Follow-up is scheduled. Okay. And number 7, the last one, a 78-year-old presents with COPD exacerbation and emphysema, and he is oxygen dependent. All right. So those are all of your questions again. Sorry that it's only 7 questions. But I hope you all will tune in on Monday and see the answers. I hope you all have a great rest of the weekend. And please let me know if you have any questions. And just be sure to look at the detail in the scenarios, okay? And remember, guys, these exercises are not official. This is just me as a veteran medical coder, just sharing what I know with the world of medical coders. Alrighty, I will let y'all go. Have a good weekend. Bye.